Hi, I'm Doug Thompson, and I want to thank you for considering the Wellness Dentistry Network. People ask me, what is the Wellness Dentistry Network and why was it created? Well, the vision was what we were trying to do is we wanted to really create and help teach how to create an environment that allows really a qualified team of professionals to achieve excellence and distinction in implementing comprehensive dental care. And we want to make sure that comprehensive dental care that they're delivering really impacts positively a whole body health. We want this idea to be timeless with no regional boundaries. That's the idea. The purpose of what we're trying to do every day in practice is to, as a WDN, is to the Wellness Dentistry Network, is to assist practitioners in the ability to do that. We want to assist them with these implementation strategies that facilitates the delivery of this kind of care that positively impacts whole body health. And we want to use a team, basically a team approach in a patient-friendly environment. That's going to be critical. So you have a team of people all working in the same direction, delivering comprehensive dental care that positively impacts health. That's the idea of the WDN. In order to do that, we have to have some core values. In other words, we have to have some methodology of behavior. So a couple things we're about is honesty and integrity, kind of in everything we do. We want to make sure that we have an attitude of teamwork, sharing, and collaboration. That's going to be critical in order for us to work together with each other and to work with other professionals. Also, we want to work with an attitude of continuous growth. We have to constantly be growing because the science is constantly evolving as to what we're doing. And the idea behind the materials that the WDN provides is dynamic. The idea is it's dynamic, it's growing, and it changes. And we want to have a positive attitude. That's always important because having a positive attitude is a big key piece to being successful in almost anything that you do. So there's some philosophy that's necessary to fulfill this purpose. In other words, you have to have some philosophical belief. And one of those beliefs is, I know that we as dentists can significantly influence patients' health, way more than I thought when I first started on this journey. We also need a methodology to do that. We have to look at, we have to have a methodology for assessing the patient, a methodology for relating these conditions to systemic health, and we want to make sure that we have a methodology that relates to systemic health and that generates other health-related conversations. That's what we're trying to do. We need to have some implementation strategies. We need to implement strategies that increase awareness for our teams and our patients about this new approach to not only performing great restorative dentistry, but how to add to it opportunities for them to be healthier in other areas. And so these implementation strategies provide tools that guide the entire process, from the assessment all the way to treatment and then ultimately to maintenance. And then the collaboration piece, well, the collaborative attitude is really necessary to fulfill our purpose because you can't do this alone. There's no way I can treat certain things alone, so I need to collaborate with other healthcare professionals. And it's a growing group of professionals. So it's a group of like-minded professionals that are continually growing in wellness concepts, willing to share, physicians willing to share with us, dentists willing to share with physicians, and so working together toward the mutual health of their patients. And actually, we need the patient engagement as well. So the goals of what we're trying to do and the goals of employing this philosophy is, one, we know we can save patients unnecessary hospital experiences and medical expenses. That's a great goal of applying our philosophy. Another goal of our methodology is to be able to have some succinct way to make the assessment so we can ensure the mouth is not negatively impacting a patient's whole body health. I like to look every patient in the eye and say, I can guarantee you your mouth is not impacting your health in a negative way. And when you can say that, that's really powerful. The goals of the implementation piece is to actually move the knowledge into motion. That's the idea. We want to move the knowledge into motion. We want to be able to educate our patients, educate our teams about this new approach and about this new opportunity. We also want to provide tools to guide the entire process from the assessment to the treatment maintenance through the content hub. And I'm going to expose the content hub here in just a couple minutes. And then the collaborative community. The collaborative community is this building, this dentists and this teams of dentists with physicians and that want to go beyond traditional repair models of fixing teeth and ensure that total body health is really exercised. And we want to educate the patients about these oral systemic relationships and connections. And so that's going to require partnering with like-minded health professionals. It's going to be solidifying the concept of the WDN community, the Wellness Dentistry Network community of people, and amplify networking opportunities. We'd hope that Wellness Dentistry Network member dentists have plenty of networking opportunities to promote themselves, their practices, and the ideas, and then the ability to support each other, each WDN member office. That's what the WDN's about, is to support and exchange ideas and assist in implementation for healthier patients and ultimately for healthier teams as well. So the philosophy, just to reiterate a little bit, you can really influence your patient's health more than you think. And what that's going to come down to in practice is inflammation management. We know that inflammation is the root at many diseases today. So if you are an expert in inflammation management, you'll be very successful in this endeavor. It's going to require early disease detection. This is a philosophical principle. We have to detect disease early because it's so much easier to treat. Detecting disease late is easy, but very, very hard to treat. And then it's going to require health education. And health education is difficult because we don't get paid for that. So we have to get paid for building a reputation and a brand, not usually around a consultative code. We can make more money doing other restorative procedures. The inflammation message is getting clearer and clearer. As medicine redefines vascular disease as an inflammatory disease of the blood vessels, we have a great opportunity, because that inflammation and what's driving that inflammation is the bugs from the mouth. And that's our wheelhouse. That's where we need to become experts in controlling the biofilm-mediated diseases, caries, and of course, periodontal disease. So that's our big opportunity. The other, a little more expanding on the methodology, how the philosophies are paired to the methodology is, we need this process, this delicate process of assessing the patient in a relatively short amount of time, and how to relate these oral conditions to systemic health. And so this methodology that we support and that we've created really generates other health-related conversations. And we do this through personalizing the patient's clinical data. So we use personalized risk assessments in our intake forms, and we use personalized clinical assessments in writing. And all this is part of the Content Hub. And the idea is we want to provide our patient everything they need and nothing they don't. So we're trying to help them prioritize what they need to have done and what they don't need to have done. And so in the beginning of the health education experience, our goal is to stimulate the patient's curiosity. We want them asking us more questions, because then we become co-diagnosticians with them and we collaborate with them for further learning and for further health education. So personalized risk assessments and personalized assessment summaries in writing is a hallmark feature of our clinical exam process. And we have videos about how to do that and what that looks like in practice. So the implementation strategies and how do we increase awareness with our team and our patients? How do we do this, and where are the tools to guide this process? But what we're trying to do in practice is create a visual culture. You know, it's like a restaurant. You walk into a restaurant, you have some idea when you look at the table linens and you look at the wait staff, you have some idea what kind of restaurant experience you're going to have. It's the same thing in your practice. If you have a visual culture to entice questions and further inquiries about what you're about, that's going to help you with the conversation. You don't have to bring it up on your own so many times. So we have methodologies to create a visual culture. We have a content hub. That's the internet portion of the Wellness Dentistry Network. That's the exchange database where we provide documents and methodologies and forms to guide the process and to streamline protocols. We also have white labeled tools that you use. These are tools that are branded for your office, branded with your name on them, that personalize your practice information so that the patients feel that it's coming directly from you and that's not a marketed piece of material. And then we have step-by-step guides. They had the implementation process in each area or topic module that I'm going to talk with you about. And then the whole philosophical key to implementing is we got to be able to collect data. We have to be able to collect data that shows the entire patient and the medical world that what we're doing makes a difference to their whole body health. And so metrics is an important piece of this as well. So in this visual culture idea, I can tell you the public does get it when they see it. And what I mean by that is I have books sitting in the operatories. I have visuals. If you don't have room, we can have these small book towers and places where patients can see different pieces of information. And they'll ask you, why do you have that book? Or how does that book relate to my health? And all you have to do is answer the question, and your team can do the same thing. So creating a visual culture is very important. It's going to be an important part of how we manage the healthcare. And the Office Forms Tools Library is also very important. It's divided up into 23 different modules. You're looking at 16 here. But when you click on these modules, each one of these modules are organized in a unique way. There's letters to patients and physician. There's patient and team awareness tools. There's diagnostic tools, and there's treatment and maintenance tools. And these documents are all laid out in this fashion in all of the modules. There's 23 different modules. Also, when you hover over a document, you get a description of the document, and then you can open up the document, you can view the document, you can print, download it. Many are white labeled or personalized for your office. And many times there's an audio file that comes with the document that explains why we made it, what we did for it, and what the intent is anyways. And again, you can use certain documents and other documents you might not find so valuable. And the collaboration piece, looking at the philosophy of collaboration, again, we want to continually grow in these wellness concepts, and we want both dentists, physicians, allied health professionals to work together for the health of their mutual patients. And what ends up happening is we also have created partners in health. Partners in health on the website are doctors or physicians or other allied health professionals that already work with the WDN member dentist. And so we know them, they know our language, and so these are reliable people. And several of these now are telemedicine groups where you can get information over the phone. So we have the WDN is privileged to be in 4 different countries right now. And so having people from other countries, they might not have the same access to healthcare that we do. And so they could get it over the phone. So that's really a nice opportunity. We're building a physician's toolbox and a content hub for physicians as well. So we have physicians that are helping guide the process of working more closely with dentists and what dentist needs, and so that we can fulfill the needs of each other. And then we want patients to be their own health advocate. So the philosophy of WDN and the collaborative side is we're collaborating with our patients to be, again, co-diagnosticians in the disease discovery process. And then the WDN community, we have whether it's forum, emails, social on Facebook, or on our annual rally. We want the WDN community to come together so that we can share the best ideas and best practices for implementing this in practice. So referrals into my practice look very different. On the right side of your screen, you see actually telephone interview sheets. And we have patients that call us now and say things like, my myeloperoxidase is elevated, my physician is concerned, or I'm in for an inflammatory illness consultation, or I have some other issue that a physician wants you to evaluate. And it's really nice to have these, because these referrals are not coming in for a broken tooth or a toothache. Oh, well, I get those because I still do all phases of general dentistry and implant dentistry. But again, we have this other opportunity. So what's unique about these patients that get referred to you by a physician? Many times they have dental issues. You'll see these diseases go hand in hand. So these patients that get referred in have quite a few dental issues, and I've done upwards of $50,000 of treatment on a patient that was referred to me for a sleep evaluation because they had AFib. So it's very, very interesting how this happens over time. So monetizing the wellness movement does not come from one single dental code. It comes from building a reputation and a brand over some long period of time. And it's more of a movement and a culture in practice. It's not a thing that you do for a few days or for a month. It's something that you grow into over time. And that's why the Wellness Dentistry Network library is designed to be digested in small bite-sized pieces and allow us to help you implement in practice along the way. So iProfession is really to help. It's really ready to help in a much bigger way. There's great value in discussing these diseases with patients, detecting disease early, making them aware of disease, of the presence of disease, and we can have a significant impact on their vascular health, their brain health. We know it's a great opportunity for us because we see 20% more patients than physicians do usually. We have research to show that. I think we can do more, and I can tell you one of the things that I do really want to encourage all of you to do, your healthcare providers, and if you're going to take care of patients and get them healthy, you need to be healthy yourself. So we have some coursework that we do. Look for these course opportunities because we like to do all the testing and different things that we can do in practice for our patients. We like for you to experience. So we have actually a wellness week in Seattle. You can look for those coming up in the future. And you can find me on the lecture circuit talking about various aspects of this all the time. So, and that's this is this week-long course in Seattle. So this is so true. When you're healthy, you want so many things, but when you're sick, you just want one. And so we're trying to prevent our patients from being sick. And so I'd like to ask you to help them as well. There's 3 critical points about why this movement's so successful. It's unique, it's relevant, and it's true. So we really hope that you'll consider and that you'll work with us and join our network and start your growth in the wellness journey. I think you'll find it very, very rewarding. So I want to thank you for taking the time to listen in, and I hope that we can get you on board soon. Thank you, and thank you so much.